ঘুম চটকে সকাল সকাল কলেজ যাচ্ছি কারণ আজ প্যালিয়েটিভ কেয়ারের উপর কলেজে একটা সেমিনার আছে। এখানে সেমিনারের স্পিকাররা সবাই শাড়ি টাড়ি পরে রেডি হয়ে গেছে, সবকিছুর প্রিপারেশন চলছে। আমিও হয়ে গেছি স্পিচ দেওয়ার জন্য একদম রেডি। আমার বন্ধুর কিন্তু এসবে কোনো ভ্রুক্ষেপ নেই। She always taught me when life gives you lemons, just say প্রিপারেশন চলছে পুরো দমে। লাস্ট টাইমের মতো আমরা নিজের পজিশন দেখে নিচ্ছি। কেউ সেলফি তুলছে, এখানে কেউ নিজের পড়া রেডি করছে, কেউ দেখে নিচ্ছে নিজের মুখটা ঠিকঠাক আছে কিনা, কেউ চিৎকার করছে, কেউ পোজ দিচ্ছে, কেউ টেনশনে আছে বসে, হাই বিউটি, কেউ জুতোও পরছে। এখানে চলছে চার্ট পোস্টার লাগানোর কাজ। দে আর লাইক আনসাং হিরোজ অফ সেমিনার, যাদের জন্য এসব পসিবল হয়। এখানে ল্যাপটপ প্রজেক্টর সেট করা হচ্ছে প্রেজেন্টেশনের জন্য। এসে গেছে এখানে আমাদের অডিয়েন্স, আমাদের থার্ড সেমিস্টারের বোনেরা। ওয়েলকাম অ্যান্ড সেমিনার শুরু হচ্ছে।
A warm welcome to you all. Today I am Megha Devna and I am pleased to be your host for today's program. So now I would like to call Madam Marna to come and share some valuable words. Good morning to all. Dear presents, my respected colleagues, and third sem and fourth sem beloved my students, my fourth sem students are presenting a seminar on palliative care. Now, palliative care is a very much important topic for that people who are the chronically ill patient, like lifelong diseases like advanced cancer, like lung cancer, stomach cancer, colon cancer, who are suffering from long-time diseases for lung, kidney and stomach, who are the old age issues. For that people, the palliative care needed for that people, for the alleviating the suffering and reduces the signs and symptoms like pain in cancer patients. That is unbearable pain in cancer patients. So through the palliative care, we should reduce the suffering from pain of that patient. We have the idea that the palliative care should defend those people who are terminally ill and end of the life. Not only that, the palliative care should defend the who are the suffering from long-time diseases. They are that begins from the grassroots level, that is the community level, and they are in palliative care should integrate the training program in our medical training and paramedical staffs, family members, and community peoples, because the only 2% are access palliative care in our country. So we improve the palliative care in our topic and in our syllabus. We believe that the palliative care is the care that reduce the suffering from the illness and suffering from the chronically ill patients. So our students starting from their seminar on palliative care. Thank you. Extremely pleased to welcome our speakers. I am requesting our speakers to come and sit in here. Today our speakers are Chandrani Chaudhary, Deepa Chatterjee, Deepika Vishwas, Ivy Sarkar, Sneha Bhattacharya, Bornika Dolvi, Omkita Dey, Rochita Mollik, Tiyasha Shao, Shumita Shao, Anusri Pal, Orpita Pal, Sritama Manna, Anshika Singh, Ipshita Chakraborty, Shreya Banerjee, Shreya Vishwas, Srija Roy, Shreya Ghosh, Nas Farhana, Yavishri Lama, Nitipriya Pramani, Shayantoni Shaha, and Orusri Dash. Caring for one is love, but caring for all is nursing. So firstly, I would like to call my fellow friend Chandani Chaudhary to come and introduce us with today's topic.
Good morning, ma'am. Good morning, everyone present here. Myself, Chandani Chaudhary. Before starting the seminar, let us watch one video. Child is there in the film. The child was suffering from cancer, and doctor has informed their parents that she would not survive more than 6 to 8 months. She had only 6 to 8 months in her hand. Now what happened? Her wish was to see Durga Puja festival in Kolkata, and this was of January month. Now, as she was only having 6 to 8 months, so it was not possible for her to be present at the time of Durga Puja. So her father decided to fulfill her wish of making that Durga Puja festival in the month of March. So why I am giving this example? Palliative care, our topic palliative care, this is also about giving care to those terminally ill patients. So terminally ill patients, we can't cure them, but we can provide them the care so that they become confident and they can come to the peaceful death. So before starting palliative care, I would like to revise what is nursing. So first let me tell the definition of nursing, that is by Virginia Henderson. So according to Virginia Henderson, the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery or peaceful death that he or she would perform unaidedly if he or she would have the necessary strength, will or knowledge. So nurses play a vital role in providing mental support, providing proper education and advocacy not only to the patients but as well as their family members. So they are the frontline healthcare providers to give compassionate and competent care to the terminally ill patients for alleviating suffering. So nurses are more likely to be present at the time of death than any other healthcare professionals. So from the time of diagnosis, during the disease and till the peaceful death, nurses are the main role playing in the front of the patients. So coming back to the topic, palliative care, it is the effective model for relieving pain and symptoms for those patients suffering from terminally ill diseases. So today our seminar is on the topic palliative care. So through this model, we will be able to gain knowledge, confident about the activities and the skills, and have favorable attitude towards the palliative care. Thank you.
Thank you, Chandani. So now we have already came to know that what palliative care is. So let's take a look on how the concept of palliative care has come and eventually evolved throughout the decades. For that, I am asking Deepa Chatterjee and Vidika Bishar to discuss on the evolutionary history of palliative care. history of palliative care. So at first we have to know about the meaning of the word palliate. The palliate word derives from the Latin word pallium, means cure or protect the patient from the distressful symptoms of the disease, especially when cure is not possible. Care of the dying patient has always been a concern in our society throughout the history. So we have a tradition in India. The ancient institution was built by King Ashoka in India had a similar characteristic with modern hospice. Although modern hospice has its roots in 19th century. Then Cicely Saunders, she was a nurse, then a social worker and also a doctor. She founded St. Christopher Hospital in 1967 to provide hospice care to patients. So the next part will be discussed by Deepika Vishwas. Thank you.
Good morning everyone. I am Deepika Vishwas and I would like to continue the topic. So, the concept of palliative care emerged out of the idea of the hospice movement started by Saunders. The term palliative care was first used by Belfour Monk in 1974. He had learned about the hospice care from Saunders, and when he came back, he started a similar ward in Royal Victoria Hospital. A new view of palliative care started to emerge after that, and a new dying process, the ideas of dying process also began to refine. Saunders recognized that nurses were the central to the care of patients at the time of their death, and because of their constant presence and skill in assisting the patients in their end of their life. Thank you so much.
Thank you, Deepa. Thank you, Deepika. To gain perfection in any field, firstly we need to get a clear concept about that in our mind. I request Ivy Shorter, Sneha Bhattacharya and Bornika Dorwe to discuss on the concepts of palliative care.
Good morning everyone, present here. As I am Ivy Shorter and I am going to discuss about the concept of palliative care. Now, as Megha said that to gain expertise and to provide quality care to the person, we ourselves have to clear the concept of palliative care. Now, let us start with the definition of palliative care. So, according to World Health Organization, palliative care is an approach that improves the quality of life and family members who are going through various problems due to life-limiting illness. And how it is done? It is done by prevention and relief of suffering through various kinds of diagnosis, which can be early diagnosis, treatment of pain, and other problems that can be psychosocial, that can be physical, that can be spiritual. Indeed, a long definition. So now the life-limiting illnesses could be cancer, neurological disease like Parkinson, Alzheimer, or any kind of multi-organ failure disease. So now, from this definition, we can get some concepts. Like palliative care reduces the suffering of persons or the patients. Like it does symptomatic management of the disease. It helps the patient to get mentally prepared for death, and it affirms the life and regards the death as a very normal process of our life cycle. It does not promote death or hastens death, and this kind of care integrates the psychological and spiritual aspects of providing care. Also, from this we can think that palliative care is only an end of life care, but in reality it is not. It has actually many scopes and dimensions. Now, the scopes are establishing an empathetic communication between the patient, between the family of the patient, who are the caregivers of patient from non-medical fields, and also establishing a good interpersonal relationship with the patient. Also, it regards death as a very normal process and mentally prepare the patient for death. Also, from palliative care, we support the family of the patient and also we support them through the course of the illness and also support them in the bereavement. So these are all, it also restores the dignity of the patient, like restoring the dignity is a very important approach in palliative care. It not only restores the dignity of the patient but also restores the dignity of caregivers, that can be family members and also the healthcare workers. So these are almost the scope of palliative care. Now the dimensions of palliative care will be discussed by Sneha Bhattacharya.
Myself Sneha Bhattacharya. Now I will discuss the dimensions of palliative care. So before discussing the dimensions of palliative care, let's recap the definition of health. According to who defines the health as a complete physical, mental and social well-being and not merely the absence of disease or infirmity. So health has four dimensions: physical, psychological or emotional, social and spiritual. So palliative care has also four dimensions of care, that is physical dimension, psychological dimension, social dimension and spiritual dimension. And these dimensions are intertwined within themselves and each of these have an important aspect over each other. So now discuss each and every dimension. First of all, physical dimension. Patient with terminally ill disease, they suffer generally from pain, nutritional deficiency, dehydration, constipation, respiratory distress and fatigue. So we have to assess these physical problems and we have to give care on this basis. Next, psychological dimension. Patient with incurable disease, they are basically in depressed mood. They suffer for long-term depression. So we have to assess their problems at that their level. They are generally thought under loss, grief, shame, and they thought, why me? What will happen with me? What will happen with my family in future? What will happen after my death? And I should consult a good doctor as earlier as possible. And I did not have sufficient money or sufficient manpower to consult a good doctor or consult a healthcare providers. So these questions may arise in the patient. So as a nursing personnel, we have to assess these questions and these problems at the level of patient. So we have to assess the need and we have to assess the need for isolation, fear of isolation, fear of loneliness, fear of death, fear of losing the loved one person and fear of incomplete task. Next, social dimension. For long-term disease, this may affect our social and economic consequences. Social and economic consequences may be related to loss of job or loss of family position, social position, loss of close family member, loss of economical hardship due to insurance deficiency or legal problems, loss of job, and loss of incomplete business, loss of own position. It may be real or it may be perspective. So we as a nursing personnel, we have to assess this dimension and we have to give care. And the next topic will be discussed by my friend Bo.
Everyone present here, I am Monica Dolby and I will be like to continue the topic. The next topic is spiritual dimension of palliative care. So when a person is sick and he or she approaches the end of their life, that has a big deal of spiritual distress there. Every person then needs to come to terms with their losses in their way. There are spiritual issues like why am I? Why is God doing this to me? What have I done to deserve this? Or God is why punishing me? This question may arise and that may worry them. There can be remorse, guilt, bargaining with God, religious issues, regret with their faith, and the biggest, meaninglessness, like their sense that their lives and sufferings are in vain, there's no meaning, and that can be a point of concern
going further, we need to understand that spiritual issues are related with meaning and purpose of life. That is related to the way they seek and experience meanings and purposes, the way they connect to environment, nature, moments, self and other people or the sacred. So, the spiritual issues may or may not be related with their religion or faith. The patient may or may not be using the religious terms to express their spiritual needs. So we don't necessarily to be the spirituality to be linked with their religion. Also, our point of concerns include their confessional deathbed prayers, their burial cloths and their funeral rites, etc. We need to think that patient maybe need time to think about their life. They maybe need to time to spend time with their closed ones. They maybe need to play their favorite music quietly in their room. Person from their faith, we should allow or encourage him to contact with him if that is essential to the patient's beliefs, life and wishes. That goes with the spiritual dimension, and now we will combine this with total pain. So pain is traditionally perceived as total pain that has the same four dimensions: physical, psychological, social and spiritual. The term total pain was coined by Dame Cicely Saunders. We already have just known about her. So this term is used when the patient feels a combined effect of psychosocial, physical and spiritual distress. And we need to address all those components and treat all those components to relieve the pain completely. Relief from total pain gives improved quality of life to patient and as well as her family. The considerable need for ongoing care of patients with incurable long-term and progressive disease should be met with the healthcare delivery system. So, we need to explore the patient's anxiety and their frequent misconceptions about the factor. See, the control of pain is not enough if the patient himself or herself have a degree of control over the situation. And these psychological factors can be a big cause of persistent pain. So, as we always do and as we always say in the field of nursing, a holistic approach is very essential in case of palliative care. Thank you.
Thank you, Sneha and Paul. So why palliative care is such an important topic? To discuss this, I would like to call Ukita Dey and Projita Purohit.
Good morning everyone, those who are present here. Myself Ukita Dey. Today I will tell about the significance of the family. So why should we do family? Or why should we apply this talk? Because when people come to their terminal illness or they're seriously ill, then they can understand the value of each and every day, and then their desire to live increases. In this stage, people suffer from many physical problems like breathlessness, severe pain, delirium, and nutrition and hydration related problems. Not only physical, as well as they suffer from many emotional and social suffering or consequences, such as fear of isolation, fear of loneliness, helplessness, depression, anxiety, and also the financial burden due to the medical issues. So palliative care is very essential because it provides a quality health care to the patient as well as patient family. The main aim of the palliative care are to provide relief from pain and other distressing symptoms, to provide relief from social and emotional suffering whole desire and decision at first to support the patient family member, and also important thing that we have to reduce the unnecessary hospital visits, because in this case everyone want their peer groups member, family members to stay with them. So we should increase the likelihood of location of death being outside of the hospital, and also provide guidance and support to the patient and patient family member in the course of the medical issue. So all over we can say that the support of palliative care can create a positive experience to the patient as well as patient's family member. So now I want to conclude my topic by saying that there is an end of cure, but there is no end of care. So thank you.
And today I am going to discuss about health conditions which need palliative care. So, people of any age whose health condition result in death or suffering need palliative care. So, it also remember that palliative care is provided to people with one or more medical conditions which are active, progressive and unlikely to be cured. So today, palliative care can be applied to many serious life-threatening conditions which are cancer, neurodegenerative disorders like Alzheimer's disease, Parkinson's disease, and any other neurodegenerative disease, and other health conditions include incurable disease and the congenital disorders. And the goal of palliative care is improve the quality of life. And it is essential to understand that palliative care is not provided to people during days or hours before their death. Care will start from the diagnosis of such health conditions.
Thank you, Ankita and Rojana. Confidence is one of the blocks. First, we need to go through its components thoroughly. To discuss the components, I would like to call Pitaka and Anusri Pal.
Good morning, ma'am, and good morning all of here present. So, before going to any topic step, we should know about the pillars of the topic. So, components are the pillars of the topic of palliative care based on which this topic is built. So, this is the key features of the topic. So, the four components of palliative care is symptom relief 1. Second one is caregiver support, third one is advanced planning, and fourth one is spiritual service. So the initial one, that is symptom relief. So palliative care is the care of the patients who are suffering from various terminally ill conditions. So in this phase, various critical symptoms may be shown by the patients. This includes insomnia, anxiety, depression, diarrhea, constipation, various of these. So we need to relieve these kind of symptoms. So to relieve these kind of symptoms, there are two features includes, that are one, pharmacological or therapeutic management, and the second one is non-pharmacological management. So the first one is non-pharmacological management, that includes using medical agents or chemical agents such as drugs. So we can give drugs for the patient who are anxious, so we can give anti-anxietics. So for patients who are depressed, we can give antidepressants, and also in this case, patients are facing diarrhea, constipation, these kind of things. So we can also give medicines for this. So these are, and also for the patient from which actual disease he or she is suffering, we also give those medicines to the patients. The next one I have told, that is non-pharmacological feature of non-pharmacological management. So non-pharmacological management, we use all kind of things except using So in this scenario, we can encourage our patients to pursue his or her hobbies that make feel good and happy to him or her. So the next one is physiotherapy, proper exercise, meditation also includes in this non-pharmacological management. The next one is patients who love to eat. We can give proper healthy foods according to their preference to the patient that make her feel free and feel good about their feelings. And also music therapy is such a good therapy for a patient who prefer music. So this all includes pharmacological and non-pharmacological management under symptom relief. The next one is caregiver support. So caregiver support is a very important thing in any problem related to a healthcare center. So caregiver support is the support of all the healthcare personnel to the patient and patient's family member. So healthcare team includes physician, nurse, microbiologist, pathologist, physiotherapist and all other social workers in the team. So they support and encourage the patient. They help to accept his or her current situation. They encourage his or her family member also. So these all include in the caregiver support. So in this section, communication is the key of all of this. Okay. So if communication is good or interpersonal relationship is good, so we can make a proper bond and patient will also feel free about to share his or her feelings and her family member also feel free to share her feelings and to ask for support and help. So these are the initial components of palliative care. The next two components will be discussed by my fellow partner.
Discuss about the components of palliative care. The two components of palliative care is already discussed by the Walsh. The next two components are the advanced care planning and spiritual care. The advanced care planning is the discussion ensure the patient values and goals of the care, which includes the freedom of the place of death. The advanced care planning is a patient-centered and voluntary and ongoing process of communication between the patient and his family members, caregivers, and healthcare professionals to understand and review, to understand and plan for the future health decision. The future health decision is also depends on the patient preference and background. The benefits of the healthcare advanced care planning is it increases the patient autonomy and reduces the unwanted and unnecessary treatment and reduce the length and the number of the hospitalization. Psychological counseling is an important part for the advanced care planning for the patient to receiving the care. So, psychologically in this condition, the patient has very anxious and very depressed, and many more side effects can be occurs or things. So, it is very important to support them and help to understand his present condition or situation, his condition. It also based on the various types such as the disease condition of the patient, socio-economical status, and the relationship between his family and family members, etc. Then the spiritual care. Attention to the spiritual components of the illness is experienced by the patient, terminally ill patient and his family members is not new for the context of the nursing care. So, spiritual includes one's faith, beliefs, sources of hopes, and attitudes towards the death, etc. The spiritual assessment is a key component of comprehensive nursing assessment for the terminally ill patient and his family members. Then the spiritual assessment is a key component of nursing assessment for terminally ill patient. Then the spiritual assessment is broader than the religion, and therefore the relevant regardless for the patient assessment of the care. Then it includes the
religious beliefs and practices and the important religious rituals and etc. Then the nurse should further explore that the harmony between the patient and his family members' beliefs, then the other source of hope and the comfort, and the presence or absence of the sources of the peace of mind and purpose in life, and the spiritual or religious belief in the illness and the care of sick person or mentally ill person, or then the medical treatment, etc. These are the four components of palliative care, and thank you.
Thank you, Anushree and Orpita. Till now, we have gained a lot of knowledge about what palliative care is, evolutionary history, concepts, components of palliative care. But at which place we can provide palliative care? I am asking Shumita Shao and Tiyasha Kundu to tell us about the places where we can provide palliative care.
Thank you, Neeta. Good morning, ma'am. Good morning to all. So, myself, Shumita Shah. Today we all discussing about the palliative care. So, let's talk about where we can provide palliative. So, patient and patient's family can decide where they want to receive palliative care. This may include first in home, in hospitals, in hospice, and in residential aged care facility. They also may move in between these different settings as their needs change. So, and many people mostly prefer to stay at home. And hospital and hospice care is needed to manage symptoms like nausea and severe pain. The first setting is home care. So home care, many people are prefer to stay at home. Making this possible often depends on the several factors. First one, the nature of the pain and the amount of care needed, and how much care or support is provided by the family and community, and whether we have someone in our family who can provide physical care and support. And second setting, hospital. If patient's condition change and patient condition change get worse and become more complex, so we can thinking to care in the hospital. So hospital. Otherwise, patient also have need to medical treatment in hospital in their ongoing palliative care. So, and the next two settings are in hospice and in the residential aged care facility and discussed by Tiyasha.
Thank you, Sunita. Good morning, everyone. Now I am going to discuss about hospice care and aged care facility. Hospice care is specialized patient-centered care unit for individuals who have been diagnosed with terminal illness and life expectancy is near about 6 months or less than 6 months. It is designed for this situation. Hospice care unit is designed for keep feeling the patient as homely as possible. There are no limitation on visiting hours in a hospice care unit. Also, it should have facilities like gardens, television, access for internet, and other facilities for fulfill patient's emotional, psychological, spiritual needs. Some hospitals may have similar rooms for hospice care, and other hospice care unit is also attached with old age care facilities, and specialized doctors and nurse will give care as per the patient's needs in hospice care unit. And the next one is aged care facility. Depending on a patient's needs, a doctor may suggest that patient has to move into a residential old age care home. In this home, a specialized geriatric doctor and specialized nursing staff will give care to patient as per their needs. Thank you.
এই তোর নাম কি রে? তোর নাম কি? ফোনটা একটু ধরবি, আয় তো ফোনটা একটু ধরবি, আমার হাত ধরে গেছে।
Thank you, Tiyasha. To understand the significance of
দুটো করে মেয়ে
palliative
করবি,
care
তারপর ছেড়ে
and
দিবি।
how it is different from other
এবার
care,
শ্রীতামা যাবে,
we need to
দাঁড়া।
know the difference between the conventional and palliative care. To discuss on this topic, I would like to call Sritama Manna and Ansika Singh.
এই ধরো একবার এই দুটো
Thank you, Sneha. Good morning, ma'am. Good morning, everyone. Today we are discussing about palliative care, and we have to know what's the difference between the conventional care and palliative care. So usually the conventional care mainly focuses on the physical problems, on the disease or the organ problems. But palliative care recognizes that a person or a human being is not just an assemble of his organs, it also includes their mind, their spirits and emotions as a whole. So palliative care is different in such a way from the conventional care. When a person is facing death or is going to die, they face various problems, not only physical like psychological, social, spiritual as we have discussed earlier. So it also affects their families and communities from which they belong. So a nurse has to keep in mind all these aspects while giving this such palliative care. And a issue in some one particular area may worsen the other issues also. Like if there is so much psychological pain or depression or something, there may be other severe physical pain also. So you have to look on that. And when the palliative care is includes all the aspects of the human being, considering it as a whole, its emotion, its spirit, all the part of the person who they are. So we have to know the particular points which are different from the conventional care and palliative care. It will be discussed by Anshika.
Thank you, Sudama. Good morning, everyone. I'm Anshika Singh, and I'm going to discuss difference between conventional approach and palliative approach. Before that, I would like to explain the old concept and the new concept that was practiced earlier and that are prevailing nowadays in the healthcare settings. So, old concept when the patient gets admitted and he is diagnosed with chronic progressive disease, we start the active treatment, and then when we get to know that the patient cannot survive, we will start the palliative care, and then after death occurs. In case of new concept, when the patient gets diagnosed with the chronic progressive disease, we start the palliative care right from the beginning of the active treatment, and palliative care increases day by day. So, and when the death occurs, we provide support and bereavement to the patient family so that they can cope up with the loss of the patient. Now, I would like to continue the difference between conventional approach and palliative approach. So, conventional approach is mainly concerned with disease, and palliative approach is mainly concerned with human dignity. Palliative approach main motto is to don't just be there, do something, and conventional approach main motto is to don't just be there, do something, and palliative approach is don't just do something, be there to support them, be there to care for them. According to conventional approach, intent is to cure the patient from the disease, and according to palliative approach, intent is to heal the patient from physically, mentally, emotionally, socially, and spiritually. It is more valuable in case of conventional approach is more valuable in case of acute episodic diseases like asthma, other weaknesses, and palliative approach is more valuable in case of chronic progressive disease like Parkinson's disease. Thank you. Next part will be discussed by
also in the whole nursing profession. I will request Imshita Chakraborty, Shreya Banerjee, Srija Roy, and Shreya Vishwas to discuss on the ethical aspect of palliative care. Thank you, Megha. Good morning, everyone present here. I am Mr. Chakraborty, and I am going to talk about the ethical aspects of palliative care. So, palliative care providers, that is the palliative care team, often meet with many ethical issues and dilemmas while providing care. Some arising questions are: can this intervention actually improve the quality of life of patients, or are we in the right way? These queries can only be solved by understanding the principle and precedents of palliative care while caring to home. Ethics in palliative care provides guidelines and codes to palliative care providers' duty, responsibility, and conduct. We nurses practice nightingale's pledge, so we must be familiar with the settings of palliative care's legal, ethical, and professional obligations. Now, there are various professional obligations when it comes to nursing context in palliative care, which will further be discussed by my friend Shreya Banerjee.
So, good morning everyone who are present here. Firstly, before the start of my topic, I would like to say thank you to Ishita to bring before us an important part of this topic, that is the palliative care. As we come to know that ethics is not only important in nursing, it is very much important while providing palliative care to the patient. So there are certain relevant issues present in the ethics related to the palliative care. So let's continue with the topic and let's discuss certain issues. So the issues included confidence, competence and ability, proxy of decision making, certain part of donation of certain part of our body or any organ donations, and withdrawing or withholding any other life prolonging treatment which the patient has been receiving, and the provisions of artificial means of supplying the nutrition as well as the hydration to the patient when he or she is not able to receive by himself or herself. So, by this we can say that there are many relevant issues which are present in the ethics related to the palliative care. So, this part is very much vital. So, the part will be next further continued by my fellow mate, Sridhar. Thank you.
Discuss the topic. Thank you, Srija. As Srija said, in nursing, the ethical decisions are taken based on autonomy, non-maleficence, beneficence, and justice. There are two other critical principles, that is dignity and truthfulness or honesty. Dignity, which means the patient and the person treating the patient have right to dignity. The health worker and the patient should always respect each other. The maintenance of dignity results in formation of a positive self-image, self-esteem, behavior and environment control. It also helps the patient feel comfortable in his or her physical and mental condition. Honesty or truthfulness implies the concept of informed consent and truth-telling. The patient should always be well aware about the risk and benefits of his current condition and the related treatment. So, who and other failures national bodies or associations have taken steps in most of the countries to ensure that relief from pain is a legal right who need palliative care should never be denied. Otherwise, it will be considered as a violation of human rights. So, therefore, we the palliative care provider team need to manage their concerns like pain, symptom control, and psychosocial care, end of life issues while respecting their dignity and ensure the care we provide. Thank you.
Thank you so much, Ipshita, Shreya, Srija, and Shreya Vishwas. Now let's talk about the need of palliative care. For that, I will call Shreya Walsh and Nas Parana.
Good morning, everyone. I am Shreya Walsh. I am going to discuss about the need of palliative care. Worldwide, there is a huge need of palliative care. Out of 7 million people die yearly, over 5 million people need palliative care. But actually, 2% people can get access of the palliative care. The elderly people who are bedbound or no one in their home, they cannot access the privilege of palliative care. Socially, communically marginalized groups and LGBTQ community, prisoners, geographically isolated people, we often forget them. But they also need palliative care. The health conditions that need palliative care, those are irrespective of any age, every people need palliative care in diseases which are active, progressive, and not likely to be cured, such as lung cancer, failure of organs, or neurodegenerative disorders like Alzheimer's disease, Parkinson's disease, etc., or severe traumatic injury, or any other incurable disease. The health conditions when palliative care are appropriate, those are at diagnosis stage, and during the treatment regimen, we also need palliative care. During the terminal life care, that is end of life care, there also palliative care needed, and during the betterment stage, there is palliative care also needed. At diagnosis, let's take the example of a cancer patient. A patient is newly diagnosed as cancer. Here we can tell them the truth about his or her diseases, the procedure, treatment, side effects of his treatment. We can tell them and include him or her in his or her treatment. During the post-cure phase, here the anxiety is heightened, so we can clarify his or her doubt and answering their questions. In terminal phase, we try to maintain a dignified, symptom-free, peaceful death. We try to ease his or her pain during the death time. And in bereavement stage, we can assure the family member to cope up with the loss of a loved one. Here it is also an important part of palliative care. And next part will be discussed by my favorite friend Nas.
Good morning, ma'am. Good morning, everyone. Myself, Nas Parana. Today, I will discuss about skills required by nurse in palliative care. Some skills that are important for palliative care nurse include communication skills. Palliative care nurse need to be able to communicate with other patients and their families to understand their needs, preferences, and concerns. They must also be able to communicate with other healthcare professionals to coordinate care and provide updates on patients' conditions. Clinical skills. Palliative care nurse must have an understanding on patients' medical conditions and treatment. They must be able to provide care to
বড় কর ছবিটা বড় কর
pain or other symptoms management skills. Pain is a common symptom for patients receiving palliative care. Palliative care nurse must have expertise in pain or other symptoms management skills, including medication administration, non-pharmacological intervention, and pain assessment. Emotional support and the palliative care nurse must be able to provide emotional support and counseling to patients and their families to help them to cope with the situation. Cultural difference. Palliative care nurse must have an understanding on cultural differences and how they can impact a patient's care. Palliative care nurse must provide care to patients in teamwork and collaboration. Palliative care nurse work as a part of team of healthcare professionals, including physicians and social workers. They must collaborate with other healthcare professionals to provide coordinated care to patients. Advocacy is key. Palliative care nurse must be able to advocate for their patients and ensure that they receive the care they need. Thank you.
ছবি তোল না দুটো, ভিডিও কর না দুটো, আর নিতে পারছি না,
Thank you, Shreya. Thank you,
আমার হাত ফেটে যাচ্ছে।
A country always has a great role in developing any field. So, what is the country's contribution? For discussing that, I would like to call here Sri Rama and Priya Pramani.
Now let's discuss about our country's contribution towards our palliative care. Palliative care is most effective when it is considered early in the treatment of illness, as it not only improves the quality of life for the patient but also reduces unnecessary hospitalization and use of healthcare services. So in India, palliative care was introduced as Santi Abedna Sadhan, which literally means peace in the absence of pain, a hospice in Mumbai in 1986. Over the next 5 years, it also established its new branches in Goa and in Delhi, but patients outside this institution did not have any access to palliative care. In 1990, two major developments occurred.
একবার ওঠ, আমি এতক্ষণ দাঁড়িয়ে আছি, একটুখানি দাঁড়াতে অবশ্যই পারবি।
Care Society in Palliative Care Kerala in 1993, which was actually a charity-based trust which provided home service and palliative care to the patient. And later, with the help of WHO, they also provided home visit programs. Second was, in the western part of the country, in Gujarat, palliative care was initiated under the Department of Anesthesiology at Gujarat Cancer and Research Institute in 1994, and that was a turning point in the history of development of palliative care in India, as it led to the formation of Indian Association of Palliative Care in 1994. Our country's other contributions are neighboring network in palliative care, which is a community-led initiative to provide home-based palliative care in Kerala, and which is the it provides country's 2/3 of Indian palliative care services and is one of the largest network in the world. Now the topic will be discussed by the
কন্টিনিউয়াস করে যাবে, একটু তুলে কর যাতে এদের মাথাগুলো না আসে।
In the continuum of care for patients who are suffering from chronic illness. Okay, so let's talk about the following components. So as we know that in our society, healthcare is provided at different levels. So palliative care should be integrated at all the levels of care. That will require proper structural and financial support. That can be provided by the health policies by the government. Then comes the next policies, which will ensure strengthening and expanding human resources, and also training of the existing health professionals, also including the palliative care in the core curriculum of the new health professionals, as well as training of the volunteers and public. Next are the medicine policy. The medicine policy will ensure that availability of medicines are there. Like in this, for example, the word analysis, which are for reducing pain and respiratory distress. By this, we can understand that a lot of progress has been done with respect to palliative care in our country. But the implementation of all the created laws and policies are not done in our country, which will require proper intervention by government and non-government institutions.
Thank you so much, Yarusri and Vidya. Lastly, I would like to call Shantanu Shaha, Shunajana Dey, and Anusri Dash to discuss on the WHO's responsibilities on palliative care.
হাতে এখানে ব্যথা করে আমার যা হচ্ছে তাহলে চিন্তা কর আমার হাতটাই এরকম একটু ঘুরিয়ে ঘুরিয়ে নিয়ে যাতে যাতে অন্তত ওদের মাথাগুলো ওতে না আসে
Palliative care is a major health-based. WHO is working with the countries to make palliative care as an important part of the healthcare system. Palliative care should be available to make palliative care available at all levels and primary healthcare approach. Palliative care is should be practiced with among the healthcare professionals by means of trainings, programs, national policies to make it more accessible. The global need for palliative care is increasing due to the increased aging population and increasing burden of communicable and non-communicable diseases. Now the other responsibilities are to be discussed by Anjana Dey.
Good morning, ma'am. Good morning, everyone. I am Shunajana Dey. Today I discuss about the responsibilities on palliative care. The first one is integrating the palliative care into all the relevant global control and health system plans. Second is assessing the development of palliative care services. Third is developing the rules and guidelines on the palliative care across the disease groups and the level of care, addressing the ethical issues related to the model of palliative care, which are also effective
তুই এটা টিপিস নিও তখন ধরে
economic sector. And the last
না
one
ছিল
is
তো
monitoring
ছিল
global
না
evaluation,
এগুলো টাচ করছিলি যখন তখন কখন বন্ধ হয়ে গেছে
services and evaluating the
তারা 11টা ছিল নাহলে টাইমটা দেখাতো না
palliative care program. That's right. Thank you.
Thank you, Shantanu. Thank you, Shunajana and Yarusri. So, living with a life-limiting disease and awareness of approaching of drain create unique stressors and new challenges. Palliative care aims to relieve the symptoms and improve the quality of life of the patient. A medical team, including allied health workers, provide palliative care to the suffering patients. Patients and families must manage the new demands associated with the illness while maintaining the quality of life and meaning within their relationship. Now with this, we have come to an end of today's seminar. Now I would request our respected madams to add or for any addition or any correction in our topic. Some valuable tips.
Good morning to all. Dear presents, my respected colleagues, and third sem and fourth sem, beloved my students. My fourth sem students are presented a seminar on palliative care. Now, palliative care is a very much important topic for that people who are the chronically ill patient, like lifelong
diseases like advanced cancer, like lung cancer, stomach cancer, colon cancer, who are suffering from long time diseases for lung, kidney and stomach, who are the old age issues. For that people, the palliative care needed for that people, for the alleviating the suffering and reduces the signs and symptoms like pain in cancer patient. That is unbearable pain in cancer patients. So through the palliative care, we should reduce the suffering from pain of that patient. We have the idea that palliative care should be given those people who are terminally ill, and end of the life. Not only that, palliative care should be given who are the suffering from long time diseases. They are that begins from the grassroots levels, that is the community level, and they are in palliative care should integrate the training program in our medical training and paramedical staffs, family members and community peoples. Because the only 2% are access palliative care in our country. So we improve the palliative care in our topic and in our syllabus. We believe that the palliative care is the care that care reduce the suffering from the illness and suffering from the chronically ill patients. So our first-time students starting from their seminar on palliative care. Thank you.
সেমিনারের পর ক্লাস হয়ে গেল কলেজ ছুটি। বৃষ্টি ভেজা রাস্তা দিয়ে চললাম বাড়ি। টাটা।